Hello, and welcome back to the Nontraditional Nurse Podcast. I'm Ellie, and today I'm joined by Jessica, a nurse who has built her career in the world of utilization management and prior authorization. So, thank you so much for joining us today, Jessica.
Thank you for having me. I'm really
Oh,
excited to do this.
yeah, we're happy to have you. Now, nursing is a side of nursing I think a lot of nurses have heard about, but don't necessarily fully understand. And it's a field that really offers a different way to use your clinical judgment. So, I'm excited to kind of break that down today. We're going to talk about what nurses actually do, what a typical day might look like, and how nurses can begin exploring this path. So, Jessica, you have worked for quite a few years in and prior auth roles. Tell us about your career in nursing and how you found out about and made that transition.
Absolutely. I started out in ICU. I'm already an outlier. I didn't start in med surge. I got my license in 99. So at that time, there was a huge nursing shortage. So LPNs could go anywhere. So I did a lot of inpatient ICU, burn unit. I've done med surge, corrections, a lot of different things. And I found myself in an outpatient clinic eventually, just because I was a single mom and I needed the regular hours. And interestingly, the clinic is what was able to get me found by a recruiter because in the outpatient setting, you actually touch insurance where you don't at the bedside. So prior authorizations for prescriptions or home health or whatever that you might need from your doctor, that starts at the clinic.
Sure.
So that information translated well to case management. So I had a recruiter reach out and offer me a temporary contract to be an OB case manager. And I thought, why not? So I just jumped in and did it. And it was a little scary. I took a pay cut at first, and the benefits weren't the best, but it was just a 1-year contract. And I got through that. And that was really my springboard into the insurance side of things. From there, I crossed over into prior authorization, and I love it. I haven't really looked back since. I think I felt a little guilty in 2020 when there was a nursing shortage, so I went back into patient care for a little bit, but nope, I'm a nurse.
Yeah, you found your place.
Yes.
I love to hear it. So for nurses who really aren't, super familiar with can you just talk about what you actually do and, what a typical day might look like for you?
Sure. So we work a lot in queues. It's a lot of file numbers. Provider submits a request. I do outpatient. There's also inpatient. We call that concurrent review. That's more your RNs. But outpatient is both RNs and LPNs. So I start my day off triaging my queue. Which cases are most likely to need an MD review? If it's not going to meet criteria, it has to go to an MD to review. If there's something, maybe it doesn't meet, but you can see in the chart, this patient really needs this, that would go to MD review, and I make a case for approving it, even though it doesn't meet criteria. Um, then, when I'm actually reviewing a case, we're comparing the chart with our national criteria. So it's either Milliman's or MCG or Interqual, and they give us criteria based on the CPT code or HCPC code. And we have our own vocabulary, so you might notice me saying some phrases that you don't recognize, and that's a big barrier, I think, to nurses finding us, is we have our own acronyms, and the job titles don't necessarily say prior authorization. They'll say clinical review.
Okay, perfect. Yeah, what is that the main like clinical review prior authorization? Are there any other job titles that you found tend to run?
Yes, there's well, I've mentioned case management, but there's also nurses that do billing, claims, appeals, concurrent review is the inpatient. So, like, they help with discharge planning, and then there's discharge planners. So
Okay.
there's a lot of ways that nurses can get into UM. Even my uncle worked for a life insurance company and he had nurses because if you're out on disability or and you need somebody to talk to, like, why are you not going back to work? That's a nurse that's reviewing that. So it's really a huge field, but we're kind of in the shadows. People don't
Yeah,
find us very easy.
I know. It's great to put a spotlight on this whole career field for sure.
Yes.
And a big part of UM nursing involves, assessing medical necessity. So, how do you obviously have your guidelines, but how do you also use your nursing clinical judgment when reviewing documentation or that sort of thing?
Sure. So it helps if the provider knows what we're looking for. That's not always the case. Um, Sometimes we get a packet of 150 pages for one procedure, or sometimes we only get one page. And so a lot of times there's a back and forth between us and the providers where we reach out, hey, do you have any documentation showing this happened or this happened? And we try to get that. We're always trying to make that chart fit into that criteria. And we're trying to take care of our patients. That's like the main goal. And I think there's a big misconception with insurance. A lot of people think, oh, it's us versus them. They're trying to do a denial. But we're really trying to make sure the patient gets the appropriate care at the appropriate time and that, maybe they don't need surgery. Maybe they need physical therapy and they might get better without surgery. So sometimes those denials are a small blessing, but it's not always perceived that way.
Yeah, I can absolutely understand where you're coming from. When you really think about, nurses doing this work like yourself and you've worked at the bedside, nurses care about their patients and nobody goes to work, trying to not do the best for their patients. So I
Right.
think in the whole, you know, this is just a piece of the puzzle in healthcare, but you are trying to get the right care. It's evidence based, typically what the
Yes.
patient needs. And if you see there's a reason for it, you're the one also trying to prove that as well. So,
Yes. And people do complicated things with their lives. So there's a lot more factors to look at than just this black and white interqual or MCG. That, they
mhm.
ask the basic, and that's where nurses really step in. We can talk to the doctors like, I know it doesn't meet, but
Yeah, I
they
mean,
have all these things happening.
and that's why there is a human behind it, or else why
Hmm.
wouldn't it already be just AI if it was black and white? But you guys
Right.
are there to, you know, be there for the gray areas and advocate for the
Yes.
patients as well.
And
So,
AI is there.
yeah.
I love AI. I'm a big I think that AI is really gonna enhance employees and make them stand out as opposed to the ones that are resistant to take it. So, I highly recommend people get to know their AI and interact with it and think of it as a tool.
Yes, I think it's like a tool, an extension. It can really like help you do things without ever, replacing yourself. But using it as a tool is so important in a lot of different ways because it's coming either way. So,
It's here. It's
yeah,
here.
absolutely. So, you talked about being an LPN. So you've built this career in UM prior auth as an LPN. So how has being an LPN really shaped your path in this field? Do you feel like it's created, any unique challenges or even advantages when talking about where you're working?
Well, I think a big advantage for an employer is we're a little bit cheaper. We have all the experience, but
Mhm.
we'll take a job with less pay and be grateful for it. So that's one side of it. But I think mostly, there's in the hospital setting, you get nurses that, oh, you're just an LPN. No, I'm a nurse. I do. I'm a nurse, the same as you, just different title. And
Absolutely.
I think it teaches us as LPNs to be a little bit more transparent because we're overseen by an RN. and that's part of the title is that you have somebody in charge of you, whereas an RN, when they graduate, they run their patients. So, we report to our RNs and we report to our doctors as well. And so I think it's a little humbling too. Most LPNs are pretty easy to work with, I've found just because of that.
Mhm.
But in insurance, I don't have a title after my name. I'm just Jessica Smith. In fact, there's probably 11 Jessica Smiths in my company right now.
Oh, wow.
Um, so it's nice to be recognized as a nurse and not have to fight that battle of see me, I'm here, I'm a nurse.
I think it's so important, that hierarchy can be really tough, and I think it doesn't always serve the patient or the mission that we're looking for if it's just to say, "I think you're lesser than me," or "I'm above you," like, it just doesn't make a lot of sense because LPNs do amazing work, and we should be grateful for the work that they do, so, I appreciate you sharing that, and just the fact that, this is a path that's accessible to LPNs because I do get LPNs
Absolutely.
that reach out and, feel like the only path forward is to continue education, so it's very cool to get that perspective.
Yes, and I work with lots of LPNs, so I'm not I'm not an outlier.
Yeah,
I've worked at several different companies doing prior authorization, and LPNs are there all the time.
wonderful. So when it comes to, translating your bedside skills to what do you feel like really translated the best, or what types of skills do you think are important to bring with you?
The patient education piece, is huge because we have to translate denial letters into 5th grade language, and that can be difficult, especially if it's genetic testing, and I don't understand what some of the terms, so that can be a little challenging, but if you think of it as a patient education piece, that's what we do. We translate complicated things and talk it down to a level so we can meet our patients where they are. So
Absolutely.
that's helped a lot. The other thing is just knowing how insurance works. Be curious and interact with your insurance. Most insurance plans offer case management and they have all these education programs for their patients. And if you're wanting to break into insurance, start participating in those programs and see what are they doing and maybe you that resonates with you and like, hey, I do this too. I could do this. Um I think also talking with your AI and having it look at your resume and, well, you could word this as, I don't just do patient education, I translate procedures at a patient level. So
Yeah.
AI can be helpful with that as well.
Yeah. I love the advice of, kind of seeing it from the patient side of things because so many times as nurses, we're just one sided. And then when you finally get flipped over into that patient side, you're like, oh my God, I can't believe that this people are dealing with this.
Yeah.
So
Yeah.
I totally agree that, getting that perspective and then you're just going to be able to serve your patients better as well. I think that's so
Yes.
important.
And that's really what it is. Like we really genuinely care. And I have such an amazing team. We all help each other out if we have a question or if we see something, we hop on teams. I've never met well, I've met one of my coworkers. She lives in Louisiana, so I got to go visit her.
Oh, fun.
Um, but it's also interesting to be in your house all the time and work from home and have these coworkers that you have this relationship with that you've never met in person. It's quite an adjustment.
Yeah, and I mean it's so obvious that you have a lot of passion for this, and I think that is something that is really important when it comes to looking at jobs. I think sometimes people think that remote work is just this answer to everything, but there really are so many facets of it, and it still has to fill your cup at the end of the day. You can be miserable at a
Yes.
bedside job just like you can be miserable from your computer at home.
Oh, yes, and I've had some roles in insurance, not my current role, but I've had some that just really it was mentally exhausting,
Mhm.
and those weren't the roles for me. I found my place where I'm at now. I'm incredibly happy with my management and everything. So I'm happy to help people find this path. But just because you work from home doesn't mean it's a walk in the park.
Right.
Something that most people don't realize is when you work from home, a lot of people will come out of the woodwork. Hey, can you take me to my appointment? Or can you do this for me because you're home? And it's like, No, I'm working. I have deadlines I
Yes.
have to meet."
You're forgetting about
um,
the work part.
yes. And it becomes so easy to, hey, can you watch my kid for me? Or can you do
Mhm.
this thing for me? So you really have to be good at setting boundaries. Like, nope, from 8 to 5, I know I'm home, but I'm not
Mhm.
available. I'm
Yes.
just pretend I'm at work.
Yeah, that makes so much sense. So, what are you probably touched on this a little bit, but what are some of your favorite things about working as a UM nurse?
I love reading all the charts. I it's so interesting to see all the different ways people experience healthcare. And I see the frustrations, I see the happiness, I see the joy, I see it all in the charts. And I really love that piece of it. It's never boring. You always get something new, and it's like, "Whoa, I didn't even know this was possible." Um, I also like the flexibility. I don't have to wear scrubs. I can get my nails done.
Yeah.
I can put my hair down if I want, and I got it up in a pony, but um,
Yeah, so just a different setting for sure. Now, on the flip side, I'm sure there's challenges as well. So, what are some of the things that you found, was kind of a big deal when transitioning into this role, or some of the challenges you found along the way?
sure. My first work from home role, I was a single mom, and I was working a lot of overtime, and I just felt so isolated that there's a mental health component to it. I wasn't getting that socialization, and I it really affected my mental health, and I was getting depressed. And it's like, "Wait, I'm not when did I shower?" And when you start getting to that point, it's like, "Wait, maybe I need to do something else."
Yeah.
So, I worked on me, and I'm really proud of how far I've come with mental health. And now I have a partner that he also works from home. So I have that social interaction. So for me, I can't be a single person, the only one in the house. I'm too social. I have to have some sort of social interaction, whether it's another person that's home or teammates that I can just call on the phone. I've really learned to connect with my team.
Yeah, that's wonderful, and something that I went through something similar going remote where you just don't quite understand, like, how much you appreciate just, like, your built-in best friends at work, right? You have
Yes.
so many people that you get to see, like, several times a week and catch up with, and, I just even remember during COVID how hard it was to be at the hospital, but I didn't wanna be anywhere else because my husband was driving himself crazy at home, and I
Yeah.
was so happy to see my friends all the time when it was a time where you couldn't be doing that typically. So, I think that can't be, like, overstated enough is to, you know, think about it from all angles, make sure that you're okay kinda working. Sometimes you feel like you're on an island and you have to be so
Yes.
intentional about those relationships and working with your coworkers and everything like that. So
Mhm.
I appreciate you saying that.
Yeah. And we'll do funny things, we'll check on each other about 3 o'clock. "Hey, how's everyone doing? Anyone need anything?" We send
Yeah.
funny memes. "I need coffee," or
Yeah.
"I need to go to bed."
It makes a difference, it really
Mhm.
does. Yes. So, what do you feel like are some of the biggest barriers to get into the field of UM? Because the job market is a little bit brutal right now, so what do you
It
think
really
is
is.
tough?
I think finding it is the hardest
Mhm.
problem. You almost need to be found by a recruiter. And I've talked to some recruiters, and they don't always post the positions. And when they do post the positions, it's through another company that you don't recognize. So, like, everybody recognizes the name Anthem or
Mhm.
United Health Group, or those names are recognizable, but a lot of times when they're hiring, they're going through recruiters that are listing their company. So it's hard to find that foot in the door, and you almost have to take a chance with a recruiter. And that's a little scary.
Yeah.
But if you really wanna do it, that's the best way to get in, is take that temporary contract and really, like, put 110% into learning it as fast as you can, get to know your teammates, network. LinkedIn is amazing. A lot of times it's not what you know, it's who you know,
Yes.
and it's so you have to position yourself to where you can be found and
Mhm.
really, like, make your resume stand out for that position, not just, "I did wound care, and I've done MedPass, and I've done" wi "Have you touched insurance?" Like
Right, find the ways that you have touched it. Yeah, and
mhm.
I see a lot of recruiters say that they spend, the vast majority of their day on LinkedIn. So, firstly, not having a LinkedIn, I think, is a huge disservice to yourself. Making sure you have a profile picture, making sure that it's up to date and sells yourself before the recruiter even talks to you. But
Yes.
also not being afraid to do those cold outreaches. You see someone working in UM, just reach out to them. That's what I did to talk to you.
Yes, I
Yeah. And so I think it's so important to market yourself because, it used to be a different world where it might be easy to be found, but you really have to put some work in to,
yeah,
kinda leverage that these days.
yep, and I
Uh,
don't know of anybody with any special certifications or anything,
okay.
um other than case managers have the certified case management, but for prior authorization, we want somebody that's flexible, that is quick. If you're still taking notes with pen and paper, stop. Go paper free. Learn
Yeah.
how to quickly take notes, whether it's dictation or learn how to use your computer. Learn those computer shortcuts. Um, Microsoft offers a lot of classes for free that you can take and learn Excel or how to even use Word. I barely type anymore 'cause well, I used my AI to teach me how to use Word. So,
Yeah.
um,
And there is just, like, limitless free resources on any tool
mhm,
that you wanna use, YouTube will there's a video for it, so I completely
yes.
agree. The free education versus, like it sounds like the certifications aren't necessary to break into this role.
No.
Alright, and how we kinda like to wrap it up, I know you've already given some great advice, but, if we have a bedside nurse who really wants to get into do you have any, like, final advice that you think, would make them a really competitive candidate or anything else?
If you can show confidence, and I think confidence is the big thing, I know my patients, I'm a patient advocate. I've seen a lot of things. I can tell when somebody needs something and when they don't. I think that's huge. And knowing when you're wrong, admitting like, "Oh, wait, maybe I read this wrong," and knowing when to hand it off to a doctor or have another teammate look at it. I think that's huge. And just being flexible and teachable
Mhm.
is really
Yeah,
important.
yeah, I think showing that your ability to learn when you've jumped into new things in the past, and how you can also learn a new skill, but yeah, probably familiarizing yourself with all the lingo you talked about as well, that would probably be foreign to me. So
Yes, we have TATs. That's we're always fighting TAT, and that's turnaround time.
okay, I love it. Well, Jessica, thank you so much for joining us today. You've shared some great experience and really a ton of awesome advice for nurses. So thanks again.
Thank you for having me.
Of course. And for any of our listeners, if you're listening and you felt this helped you better understand what nurses do or maybe opened your eyes to a new direction, make sure you're subscribed to the Non-Traditional Nurse so you don't miss any future interviews or career deep dives. So thanks everyone for being here, and we will see you next time.